Hello, my name is James Farmer, and during the months of June and July 2008 I made this documentary. It follows my journey around India visiting the work of Lepra Health in Action, a charity that runs healthcare projects in the poorest parts of the world. On day one I arrived in Hyderabad, the state capital of Andhra Pradesh. On day two, still in Hyderabad, I visited the work of the Umeed project. My first stop was the King Koti Hospital, in which Lepra runs a designated microscopy centre, which tests for, diagnoses and treats cases of tuberculosis. 2-year-old Mario Renaud was referred here 5 months ago. He was tested for and diagnosed with TB. He is now coming to the end of a 6-month course of treatment, which involves him coming to the centre to take his medication, and by the end of which he should be completely cured. In the afternoon I saw the services offered at the Umeed Health Centre with the aim of the prevention of disability in leprosy patients. The smear tests, nerve function tests and sensory testing detect the disease before disabilities due to nerve damage set in. For patients where damage has already occurred, the physiotherapy department teaches self-care exercises and cleaning that strengthen weakened areas and prevent infection. The ulcer management department cleans infections that do occur and makes specialist footwear to prevent further damage. On day 3 I visited the work of the Arth Avahan project. I started at a clinic in Ramayan Pet that provides healthcare exclusively to female sex workers. The women receive regular checkups, free contraception, counselling and education on the contraction of STIs. Some of these women become outreach workers and peer educators. These are voluntary positions that involve spreading the education they have received to brothels and the wider sex worker community. The drop-in centre next door to the clinic offers a safe place to socialise, and today was used to present bags of rice to the HIV positive members of their group. I then went to a clinic that caters for male sex workers in Kamareddy. As with the clinic in Ramayan Pet, this centre is part of Lepra's targeted intervention programme, which identifies the people most at risk from HIV/AIDS and forms projects to help them. Homosexuality is illegal in India, so male sex workers operate in an even more isolated and secretive way than their female counterparts. This centre offers them the chance to form a community, and through that community, spread the education on the prevention of HIV/AIDS. Working together, they have recently raised money for books and schooling for AIDS orphans, and plan to start teaching dance classes, for which this man must be the front runner to teach. On day 4, still with the Arth Avahan project, I visited the Gudpala Village Health Committee. The committee structure of presidents, secretaries and general members was put in place by Lepra. Then with the committee formed, the villagers were left to decide their own agenda. 4 years ago the village was the most malaria endemic of the region. When the committee was established, their first objective was to tackle this problem. Lepra supplied them with mosquito nets and the education on how to use them, as well as gambusha fish, which eat mosquito larvae. They are now the least malaria endemic village of the region, with no cases reported this year. The committee structure gives every villager the chance to be listened to and to make changes in their community. Having solved their malaria problem, the committee is now lobbying the government for improved sanitation, water and electricity supply. While Lepra maintains supervision of these groups after they are established, they are very much independent and self-sustaining. This means Lepra can turn its attention to the next group of people in need of support. My next stop was a disability self-help group established by Lepra in the village of Palsy. The aim of forming the group was to bring isolated people with common problems together. They were given education on the government benefits they were entitled to, so people struggling to make a living started to claim disability benefit, free healthcare and free bus and train passes. In order to help each other further, they opened a joint bank account. Each member pays in a monthly amount, then if they need financial aid or help starting a business, they can ask the group for a loan. Coming together has also given them greater power and influence, as they are now recognised by the government as an official welfare group. After travelling back to Hyderabad, on day 5 I flew to the state of Bihar to see the work of BHAP. On day 6 I went to the Mungo Referral Unit. The centre offers testing and ongoing treatment for various diseases, as well as distributing free condoms, running community education programs, and a daily clinic where members of the community can come and see a doctor and receive medication free of charge. The education of the community is particularly important in the treatment of Kala Jar, or black fever. This is a disease spread by sandflies that live in the mud walls of people's houses. The first sign of this disease is a fever, so many people do not seek medical attention. As the disease progresses, the skin blackens and the spleen expands, leading to a swollen stomach. Left untreated, the disease is fatal. The work of the centre is to make the symptoms of the disease common knowledge in the community, to encourage early detection and treatment. There is also a physiotherapy department dealing with the prevention of disability. One patient visiting this department was Shishida Prasad. He has lymphatic filariasis, a disease spread by mosquitoes which results in abnormal fluid retention. The effects of the disease cannot be completely eradicated, but these cleaning practices can prevent infection and worsening disability. After suffering from the disease for 30 years, in the 4 months of treatment Mr. Prasad has received, he has had a 30% reduction in the size of his leg. The centre also offers pre- and post-test counselling to HIV/AIDS patients. This woman told the counsellor that she had a urinary tract infection, but that her husband was convinced it was AIDS and had thrown her out the house. The counsellor arranged for an HIV test to put her mind at ease, and assured the woman she would visit her house herself to counsel her husband on the realities of HIV.